Hello friends, let's revise ENT quickly. Okay, so let's talk about transverse diameter of middle ear. So there are three divisions: epitympanum, mesotympanum, hypotympanum, and the narrowest transverse diameter is of mesotympanum. Mesotympanum only 2 mm, and largest is epitympanum. Next point, distance between promontory and tympanic membrane is 2 mm, and this corresponds to here this mesotympanum. So what is this structure? This radius diagrammatic presentation here is tegment tympani. This is a roof of middle ear. Next image. So this is a diagrammatic representation of middle ear. So this bulging is promontory, and this is medial. This is floor we can say floor, and the above roof is tympanic membrane that is removed here to look through these internal structures. So floor consists of this structure. There is a prominence of a lateral semicircular canal, and this structure, this is the facial canal through which facial nerve is going through, and oval window, round window, and pyramidal eminence is also sorry, not pyramidal eminence. um, okay, and this is the anterior wall of middle ear. So anterior wall, it has the TT muscle, tensor tympani muscle, and it has this hole. This is what? Pharyngotympanic tube, Eustachian tube. Okay, and the and this nerve is a continuation of cauda tympani nerve. Okay, so what will happen if this middle ear medial wall is absent? So the internal jugular vein IJV will be very prone to damage by surgery. Okay, so next one, if the floor of middle ear absent, there is possible trauma to internal jugular vein during ear surgery. Okay, so what is this diagram is showing? So this is here, this is laterally placed. Okay, this is outer atic wall, also known as scutum, and just below this one, this is what? Pars flaccida. This is known as, or these two structure together is in epitympanum, and what is this? So laterally, this is pars tensa. So this is tense part of tympanic membrane. This is inside mesotympanum, and all these three structure together, it forms a lateral wall of middle ear. So once more, we have three divisions: epitympanum, mesotympanum, and lower ends what? Hypotympanum. Next, something about facial recess. So where this is placed, so we see this is facial recess, this depression, cavity like. Okay, so we have lateral structure and somewhat medial structure. Lateral structure to this facial recess is placed what? Cauda tympani, and the medial one is stapedius muscles. Okay, so of course here what we see, this is a tensor tympani. So this wall is what? Anterior wall, and so this will be posterior wall. So posterior wall has facial races. It has a surgical importance, we will see later. Intact canal wall technique. What is this? Approaching to middle ear through posterior sinus, also known as facial recess or suprapyramidal recess. So intact canal wall technique is approaching of middle ear through facial recess. Just we have seen facial recess here. So here laterally is coda tympani and medially stapedius muscles. Here the approaching to facial recess, posterior canal wall is not disturbed here. Okay, what is promontory? Promontory is the basal turn of cochlea that has labyrinth. So promontory is the bulging. So we can see here. So this is a promontory, and it is what? Bulging of cochlea, basal turn of cochlea. Next one, stapes. It's also known as stirrup. Next one, type of joint in middle ear ossicles. What is this? Synovial joint. So type of joint in middle ear is in between ossicle is synovial joint. Next one, myelo-incudal joint. Myelo-incudal joint is a saddle type of joint. Okay, fossa incudis. It relates what? Incus short process. So what is this? Fossa incudis, depression in posterior wall. Fossa incudis relate to incus short process, that is depression in posterior wall. Next one, stapes foot place cause vibration of scala vestibuli. Next one, round window. It is covered by secondary tympanic membrane. Sorry, processus cochleaformis. It attach what? Tendon of tensor tympani, and this is the landmark of first genu of facial nerve and geniculate ganglion. Landmark of first genu of facial nerve and geniculate ganglion. Processus cochleaformis. Next one, stapedial reflex. It is what? Bilateral contraction of stapedial muscle if patient hear very loud sound at 70 to 100 decibel or more, and efferent path is by 7th nerve, afferent 8th nerve, and the center is superior olivary nucleus, SON, superior olivary nucleus. Next one, tensor tympani muscle. It is supplied by branch from medial pterygoid nerve, that is in turn branch of what? Mandibular branch from mandibular division of trigeminal nerve. So TT muscle, tensor tympani muscle, supplied by branch from medial pterygoid nerve, that is branch of mandibular division of trigeminal nerve. Next one, Sensory supply to middle ear cavity is by glossopharyngeal nerve ninth. Sorry. Tympanic plexus. Tympanic plexus. It consists of three nerves. First is a glossopharyngeal nerve that form tympanic branch, and two nerve is a superior corticotympanic nerve and inferior corticotympanic nerve, and these are from internal carotid plexus, and these are sympathetic fibers. Okay, next one, facial nerve, horizontal in medial wall, that forms third part of facial nerve, and vertical in posterior wall, that forms fourth part of facial nerve. Next one, chorda tympani, it runs between malleus and incus. Next one, lesser petrossal nerve, it synapse in otic ganglion. Okay, it is parasympathetic and supplies to parotid gland, and it is branch of tympanic plexus and formed over promontory. So where is promontory? That is medial wall, means floor or floor of middle ear. Okay friends, that's thank you very much. Please like and subscribe.